Have you ever found yourself wide awake at 3 a.m., staring at the ceiling, your mind racing as you wonder why sleep has suddenly escaped you? This is something that many older adults experience, and it's more common than you might think. For some, it becomes a frustrating and frequent issue, with people often waking up around this time and struggling to fall back asleep. But why is this happening? What causes this disruption in sleep, and what does it mean for your health? If you've been waking up at 3 a.m. or experiencing disrupted sleep on a regular basis, you're not alone. In fact, many older adults face this challenge as they age. While it may seem like a normal part of getting older, it's important to understand the underlying factors at play. Waking up at 3 a.m. isn't just a random occurrence. It's often a signal that something in the body's sleep patterns has changed. In this video, we'll explore the science behind why older adults keep waking up at this mysterious hour. We'll dive into the role of aging, hormones, lifestyle choices, and even the spiritual and psychological implications. More importantly, we'll uncover what it means for your health and how you can take back control of your sleep. As we age, our sleep patterns change. When we're younger, we usually sleep deeply and consistently throughout the night, cycling through the various stages of sleep. But as we get older, these patterns start to shift. One of the main changes is in the circadian rhythm, our internal body clock that regulates sleep-wake cycles. The circadian rhythm gets weaker as we age, and this can make it harder for older adults to stay in deep sleep for extended periods. Instead, they might spend more time in light sleep, which is why waking up in the middle of the night, particularly around 3 a.m., can become more common. Another key factor in why older adults wake up at 3 a.m. is the body's production of melatonin. Melatonin is a hormone that plays a crucial role in regulating sleep. It helps signal to the brain that it's time to sleep and prepares the body for rest. However, as we get older, melatonin production naturally decreases. This decline can lead to lighter sleep and more frequent awakenings during the night. For some seniors, the drop in melatonin levels means they might fall asleep earlier, but the trade-off is waking up in the early hours of the morning, often around 3 a.m., unable to drift back into a restful sleep. Cortisol, the body's primary stress hormone, also plays a role in sleep patterns. Ideally, cortisol levels should be low during the night, gradually rising in the early morning to help us wake up. However, in older adults, cortisol levels can rise prematurely. This can lead to a wakefulness spike around 3 a.m., causing the person to feel alert and unable to fall back asleep. This premature increase in cortisol can result from factors like stress, anxiety, or simply the natural aging process. Beyond these hormonal changes, there are other factors that contribute to waking up at 3 a.m. Many older adults deal with medical conditions that interfere with their sleep. For example, chronic pain from conditions like arthritis, back problems, or neuropathy can make it uncomfortable to stay asleep. Those who suffer from sleep apnea, a condition in which breathing stops and starts throughout the night, may experience frequent awakenings as their bodies struggle to breathe properly during sleep. Similarly, restless leg syndrome, which causes an uncontrollable urge to move the legs during the night, can also lead to disrupted sleep and early morning wake-ups. Another common issue that affects sleep is frequent urination or nocturia. As we age, the bladder becomes less efficient at holding urine for long periods of time. This leads to more frequent trips to the bathroom during the night, often causing people to wake up several times. Sometimes these bathroom trips happen around 3 a.m., making it harder to return to sleep. The interruption of sleep for something as routine as using the bathroom can create a cycle of broken rest, leaving people feeling exhausted the next day. Mental health factors are another crucial piece of the puzzle. As we age, it's common to experience stress or anxiety about health, finances, or family matters. These worries can become more pronounced at night when the distractions of the day are gone and we're left alone with our thoughts. Anxiety, depression, or even the fear of aging can trigger restlessness in the early hours of the morning, particularly around 3 a.m., when the body and mind are more sensitive to stress. Sometimes these mental health challenges can become a barrier to deep, uninterrupted sleep, making it difficult to stay asleep once waking up in the early morning. Medications, which are common in older adults, can also contribute to sleep disruptions. Certain medications prescribed for conditions like high blood pressure, heart disease, and mental health disorders can interfere with the natural sleep cycle. For example, some antidepressants or medications for anxiety can cause insomnia or early awakenings. If you take medication and notice sleep disruptions, it's important to discuss these concerns with your doctor, as they may be able to adjust the prescription or recommend an alternative. Diet and lifestyle choices play a significant role in sleep quality as well. Consuming caffeine in the afternoon or evening can prevent the body from winding down properly before bedtime. Similarly, alcohol, while it might make you feel drowsy initially, can disrupt sleep later in the night, leading to awakenings in the early hours. Eating large meals too close to bedtime can also cause discomfort, indigestion, or acid reflux, making it harder to fall and stay asleep. Blue light exposure from screens is another factor that can interfere with sleep. The bright light emitted by phones, tablets, and computers can trick the brain into staying awake by suppressing melatonin production. Many people engage with screens late into the evening, whether it's checking emails, watching TV, or scrolling through social media, which can disrupt the body's natural sleep-wake cycle and make it harder to stay asleep. But what happens when this early morning wake-up becomes a regular pattern? Chronic sleep disruption can have a significant impact on overall health. Poor sleep is linked to a host of health issues, including cognitive decline, memory problems, and difficulty concentrating. Over time, it can also weaken the immune system, leaving the body more vulnerable to illness. Sleep deprivation has been associated with increased risks of cardiovascular disease, high blood pressure, and diabetes. Mentally, a lack of proper rest can contribute to irritability, anxiety, and even depression. So what can you do about it? The good news is that there are steps you can take to improve your sleep and reduce those early morning wake-ups. First, focus on improving your sleep environment. Keep your bedroom cool, dark, and quiet. Consider using blackout curtains or an eye mask to block out light, and a white noise machine or earplugs to minimize disruptive sounds. Establishing a consistent sleep schedule is also important. Go to bed and wake up at the same time every day, even on weekends. This helps regulate your circadian rhythm and can improve the quality of your sleep. Try to avoid naps during the day, especially long ones, as they can interfere with your ability to sleep at night. Managing stress and anxiety is key as well. Practicing relaxation techniques such as deep breathing, meditation, or gentle stretching before bed can calm the mind and prepare the body for sleep. If mental health is a contributing factor, don't hesitate to talk to a doctor or therapist about potential treatments or therapies. If you're struggling with frequent nighttime trips to the bathroom, make sure to limit fluids in the evening and ensure that the path to the bathroom is well lit and free from obstacles. If you suspect a medical condition like sleep apnea or restless leg syndrome is affecting your sleep, it's crucial to seek professional help for diagnosis and treatment. Finally, be mindful of what you eat and drink before bed. Avoid caffeine and alcohol in the evening, and try to have your last meal at least 2 to 3 hours before you go to sleep. A light snack before bed, such as a banana or a handful of nuts, may help promote restful sleep without causing discomfort. If you continue to experience frequent awakenings despite making these adjustments, it may be time to consult a healthcare professional. A sleep specialist can help identify underlying causes and recommend treatments to improve your sleep quality. Waking up at 3 a.m. is a common issue faced by many older adults, and while it may seem like a frustrating and unavoidable part of aging, there are clear reasons behind it. From changes in the circadian rhythm and melatonin production to underlying health conditions, lifestyle choices, and mental health factors, the causes of early morning wakefulness are complex and multifaceted. However, by understanding these causes, we can take practical steps to improve sleep quality and regain control over our rest. It's important to remember that disrupted sleep, especially waking up at odd hours like 3 a.m., doesn't have to be a permanent condition. With small adjustments to your sleep environment, routine, diet, and stress management, you can significantly improve your chances of getting a full, uninterrupted night of rest. This not only helps to improve your mood and energy levels, but also has long-term benefits for your physical and mental health. If lifestyle changes don't seem to help, don't hesitate to seek professional advice. A healthcare provider or sleep specialist can help identify underlying medical conditions like sleep apnea or restless leg syndrome and work with you on strategies or treatments to address them. Sleep disorders are not something you should simply accept as part of aging. There is always hope for improvement, and by taking action, you can enhance your quality of life. As we age, sleep becomes even more crucial to maintaining our overall well-being. A good night's sleep is essential for cognitive function, emotional health, physical vitality, and even longevity. So don't give up on finding a solution to your sleep troubles. If you are experiencing frequent wake-ups in the middle of the night, especially at 3 a.m., it's time to take a proactive approach. Your body and mind will thank you for it. Thank you for watching, and if you found this video helpful, don't forget to like, subscribe, and share your thoughts or experiences in the comments below. We love hearing from you. Stay well, sleep well, and take care of yourself, because restful sleep is the foundation of a healthy life.